make the world a better place. Take a look at yourself and make a change.
Well, it's that timely message, right?
Isn't it?
Yes, ma'am.
Listen, Jamaica is targeting the immunization of 1.9 million people to achieve herd immunity of 65% by March 2022. However, to date, only 7% of the population is fully vaccinated. Zooming in to discuss vaccine hesitancies, consultant, bioethicist, and family physician, Dr. Derek Aarons. Good morning, Doc. How are you this morning?
Good morning, Delia, and good morning to all your viewers and all persons across Jamaica.
All right, Doc. I'm going to start with the very first thing that threw me. Who is a bioethicist?
A bioethicist is really a person who has specialized in bioethics. Simply put, bioethics is the ethics of life. But most persons know about medical ethics, within the healthcare setting, what doctors and nurses should or should not do. Mm-hmm. Those are what they are familiar with. So they know about medical ethics.
Right.
However, because humans are involved, and particularly now, research is necessary with humans, we have research ethics. And so research ethics has been a fundamental part of the research industry, particularly relevant with these vaccines and so on. So research ethics is a part of bioethics. Oh. Then there's public health ethics, because right now we're dealing with public health crisis. Mm-hmm. And so there are ethical considerations to be considered: transparency, health necessity, distribution, equity, distributive justice. All of those are public health ethical principles.
Okay.
And so those are four critical legs. Three critical legs. But of course, the environmental ethics is important, ethics in the life sciences. Once you're dealing with human beings, ethical considerations are always important because we're always interacting with each other.
Yeah.
And so bioethics comprises all of those particular subfields.
Yes. And
interesting.
Boy, we're interacting wholly now, Doc, and vaccine hesitancy. What are your thoughts on that here in Jamaica?
It is unfortunate that we have come to this because Jamaica has a rich, proud heritage of vaccinations going back to the 1960s. In fact, what we did in public health vaccination in the 1960s and 70s made us the pride of the world. Mm-hmm. What we achieved ranked us among first world countries with our public health policies and vaccination. And so fast forward 30 or 40 years that we should be having this type of discussion and concern within our society is very unfortunate. And it speaks so much to what has happened, certainly over the last couple of years, in terms of misinformation, some unfortunate, some intentional by persons, because we've always had persons who are vaccine resistant, who don't believe in vaccines. Mm-hmm. But by and large, in most societies, all persons, because they're concerned about public health, would wish to prevent the loss of life. Yeah. And if vaccines are going to help us to do that, and they did so for children, they did so for adults, smallpox, polio, diphtheria, measles, you name it, mm-hmm. measles, mm-hmm. All of those came as a part of vaccines in Jamaica that we took readily. While the hesitancy now, that is another story.
Yeah. You've gone on record to say persons who are against taking the vaccine should stay home. And you go as far as to describe them as selfish. They only think of themselves, their own fears, and their own health. And once they move beyond their own concerns, you say ethics comes in. Ethics really says, how should I conduct myself in the presence of others? Is there a fundamental misunderstanding about this virus in particular that people don't understand, that if I don't, in not protecting myself, I'm also not protecting you? The collective responsibility, is that the piece that's missing? Even in the face of the misinformation on what people are hearing, do people fundamentally understand that what I do with regard to this protects not just me, but everybody else I love and even people I don't know?
Perfect. And that is it. That is why it is always important to explain these concepts to persons. You as an individual have every right to do what you wish within your own body. what you allow into your body, what you eat, what you drink, etc. But that's just you. Once you move beyond you, the person, and begin to interact with others, then ethical considerations kick in because you can affect them. You can carry things to them. You can pick up things from them. And so that is where the states and public health specialists have an interest in ensuring that what happens in the public space seeks to protect everyone who interacts in that particular medium. Whether they be walking on the streets, going to a park, going to the movies, going wherever you interact, public transportation, those are issues beyond the individual concerns about what should happen to their bodies.
Yeah. And this is where the idea of ethics comes in, that because we're juggling the right to protect the society versus the right of having a choice.
Right.
And this is where the heads are butting, because people are saying, listen, it's all right to be able to defend ourselves effectively against COVID. And then there's another thing that says, but it's all right to decide not to take it. How do we balance the ethics of both things?
And that is where I provided some guidance that Simone just quoted. You have a right to do all of those things concerning yourself, which means that you'll only have that control within your household. Once you move out into the public space, then other considerations kick in. The concern for others, you being your brother's keeper, to keep them safe and secure. You could be carrying that virus in your nose without knowing it and passing it on to them. And so the state has a right to protect those persons who you may be infected unknowingly, because we know that we learned last year, they're asymptomatic carriers.
Right.
People can carry it around. So not because I feel healthy, I feel I should be able to go out and not wear a mask and do whatever I please.
Yeah.
And you know, so
Doc,
those are.
you sound like you're advocating. You keep saying the state has a right. You sound like you're advocating for mandatory vaccines. Are you?
I don't have particular preferences either way. I'm just saying these are the circumstances that have to be considered.
Okay.
Because you see, you have to reach a particular target. Because the state has an interest in protecting the health of all persons, all inhabitants. And right now, the best way of getting there is to reach herd immunity in protection.
Right.
Now, the means through which you do that will determine what the state does. If you can get voluntary vaccination going up to 80%, then you wouldn't have to mandate it. But if persons are going to, quote unquote, resist taking it, and we can go into the many ramifications of why that may happen, the state still has to seek to minimize death. It also seeks to prevent the overrun on the hospitals, because hospitals, by financial structures, can only cope for a certain number of persons. And these persons have to be divided up between heart attack patients, strokes, cancers, surgery, motor vehicle accidents, and so on. If COVID-19 infected patients are going to take up all of those beds, then there must be a public health concern among the policymakers in regards to that. And how do you lessen that? How do you mitigate that? How do you prevent that from happening? And that is where, when we see that trend happening, you may well have to mandate to say no. Our system healthcare system is being overrun by this one particular healthcare issue.
Yes.
I'm not sure what the situation is in Turks. I don't know what your numbers are like in Turks. Maybe you can share that with us after. But I found it interesting a couple of weeks ago listening to our Radio Jamaica magazine program in the evening, news program, Beyond the Headlines with Deion Jackson Miller. I heard the head of a hospital at Cornwall Regional, actually, saying that 50%, roughly, of their doctors and about 30% of their nurses were vaccinated. I'm curious as to what your thoughts are with regard to these ethics where it concerns our healthcare workers in particular.
And that is a complex issue. The public should be aware that all persons, whether a doctor, nurse, we can all be very educated or have very succinct knowledge in particular subject areas, but we are also entitled to our personal beliefs. I can be, as a doctor, I can be a Christian, I can be a Muslim, I can be an atheist. That doesn't mean that I don't have a right to practice my craft. So when persons speak or persons say, okay, I'm a doctor or a nurse or healthcare worker on the front line and I don't wish to be vaccinated, it is a complex issue because by nature, they are, by the Hippocratic Oath or whatever the moral ethical considerations of their particular profession says, is that they're there to do good. And so in doing good, if I am a carrier of a particular virus that may infect my patient, am I doing good? So those are ethical considerations that we can't go into now because there are very ramifications and many principles that have to be balanced to provide us on the way forward. But we have to be aware of all of these and hope that by persuasion, by education, and by logical thinking, critical thinking, we can persuade persons towards a consideration of the greater good.
All right. Doc, thank you so much for speaking with us.
My pleasure.
Consultant, bioethicist, and family physician, Dr. Derek Aarons. Yeah.
So much to talk about and consider.
So much to talk about.
All right, after the break, folks, we're talking about caring for someone with